Hi, and welcome to my Bun7.com YouTube channel. Today I want to talk about thyroid disease and how to avoid it. Okay, so thyroid disease and how to manage this. First you need to know, what is thyroid disease? From Wikipedia, thyroid disease is a medical condition that affects the function of the thyroid gland, the endocrine organ found at the front of the neck that produces thyroid hormones. The weight of the gland is 1.5 ounces, and during a year the thyroid gland produces approximately a teaspoon of thyroid hormone. This small amount of hormone drives the metabolic rate of each of the trillions of cells in the body every day. Little variations in the thyroid hormone have big effects on the body. There are four general types of main thyroid problems. 1. Hypothyroidism, low function, caused by not having enough thyroid hormones. 2. Hypothyroidism, high function, caused by having too much thyroid hormones. 3. Structural abnormalities, most commonly enlargement of the thyroid gland. 4. Tumors, which can be benign or cancerous. About hypothyroid symptoms, okay? Fatigue, low energy, weight gain, inability to tolerate the cold, slow heart rate, hair loss, dry skin, and constipation are symptoms. Inability to lose weight, menstrual problems, and PMS. The body is in an energy saving mode. Now I will mention some of the hypothyroid symptoms, and they are irritability, weight loss, fast heartbeat, heat tolerance, diarrhea, inability to gain weight. The list goes on, but these are the most common symptoms. There may be enlargement of the thyroid in both hypothyroidism and hypothyroidism. Swelling of a part of the neck is also known as goitre. Multiple dysfunctions throughout the body can be traced back to thyroid function. Most people with hypothyroidism have Hashimoto's, about 90% of them. Hashimoto is an autoimmune disease in which the immune system attacks the body's thyroid tissue. When you visit your doctor, you should talk about this. He or she might not be aware of Hashimoto's disease. How your thyroid functions can to a certain degree be connected to your intestine, liver, and adrenal gland. Your adrenal gland and your thyroid work together. When the thyroid is burdened, the adrenals works extra hard. Now, some more about food you should limit, stop eating, or drastically cut. Okay, so sugar, milk products, grains, and junk food should be reduced. Processed food, canned food, and pre-made food. On the other hand, eat lots of vegetables, nuts and seeds, and healthy fats, omega-3, coconut oil, and olive oil. If you eat meat, there are iron and B12 in meat. Choose the grass-fed meat. And supplements that is needed for making your thyroid work properly is the pituitary glands need magnesium, B12, zinc, protein from this area is the TSH, which stands for thyroid stimulating hormone. And remember that the thyroid needs vitamin C and B12, also known as riboflavin, iodine, B3, niacin. Tyrosine, the thyroid makes T4. It's an inactive hormone. And I will mention that the liver needs vitamin A, vitamin D, iron, omega-3, selenium, and the liver converts T4 to the active T3 hormone. Vitamin A and D binds to T3, and it's called active hormone. Okay, so what test do you want to take to see if you have a thyroid problem? TSH, this hormone is secreted by the pituitary gland in the brain, stimulating the thyroid gland to produce thyroid hormone. When TSH TSH is elevated, it is a sign of underactive thyroid. The normal range is between 0.4 to 5.0, but this is a wide range. Some holistic doctors claim that the optimal levels are between 0.3 to 3.0. And some doctors suggest the range to be even more narrow. But checking only the TSH is not enough to see if you have a thyroid problem. T3 and T4 levels of T3 and T4 provide information on how the thyroid gland is functioning. If these levels are low, one might conclude that the thyroid gland is malfunctioning. Antibody tests. It is also important to look at thyroid antibody tests. Anti-thyroglobulin and antimicrocosmal antibodies. These are substances the body produces that attack the thyroid gland. Thyroid conditions like Hashimoto's disease and Graves' disease may be diagnosed by having positive antibody tests. Reverse T3 tests are rarely done in conventional medicine. If reverse T3 levels are too high, it is an indication that the body cannot convert inactive thyroid hormone T4 into active thyroid hormone T3. This is one of the most common causes of hypothyroidism and is very often missed. About the body temperature. Measuring the core temperature of the body can be very important. A low temperature indicates a low thyroid function. Too high or too low temperatures inhibit normal body functions. The optimal temperature should be between 97.8 to 98.2 Fahrenheit or 36.5 to 36.7 degrees Celsius, measured orally or under the arm. But have in mind that people function differently. You can feel fine with a low temperature, while others feel terrible with the same low temperature. This test then must be put into context with other thyroid tests as well as a physical exam and history. All tests together will give you a large bit of the total puzzle called thyroid malfunction. Thank you for listening.